Good morning. My name is Mitesh Rawal, and this presentation is for the MSN 597 Soapnote week. I think it's week second, and this Soapnote is on pulmonary adult Soapnote, and my presentation is going to be on a patient that I have seen last week at the clinic. Um, his ID is JD, date of birth uh, 206 1978. He's a 46 years Caucasian male. Arrived to clinic that afternoon alone. He drives himself. He's a very good historian, very well present, well dressed too. The subjective is a chip complaint. He was saying, I'm having wet cough for a week that's not going at all. Um, History of present illness: JD is a 46 Caucasian male, arrived to clinic, complaint of cough for one week. JD did mention that the cough started last week with some dry cough, but now it is progressive to productive cough. He does mention that his chest does hurts whenever he cough a lot. Otherwise there is no cardiac problem that he mentioned about it. JD does say that at the cough is more progressive at night rather than having in the morning, and he did mention about that he on and off he does coughing throughout the day also. uh, uh, because of getting up at night and all, he did complain that he's not getting enough sleep due to the cough at night, so he feel a little more tired uh, because of that. He does not have any fever, no nasal issue, or any headache. Jerry did try once 3 days back over-the-counter medication called NyQuil. It did not help the symptoms, but make him kind of little groggy because of feeling sleepy after taking the medication. GDD started the pain. He did mention about his pain level around like 5 out of 10 on scale. uh, Present medical history: Giri does not have any past medical history except the surgery when he was 18. He had appendix removed. Other than that, there is no major hospitalization, does not have any allergies, no food allergies, as well as seasonal allergies. Does not take any medication for anything, like especially prescribed medication. Only thing he took was NyQuil over the counter for the nasal decongestion. Family history: both parents, mom and dad, are healthy. They live in Colorado. They do not have any kind of chronic health history. Does have a sister who is 44 years, married, lives with the husband, and does not have any chronic health issue at this time. The social history: JD does not smoke, does drink occasionally with his friend, but almost for last 2 weeks he hasn't had any drinks due to he wasn't feeling good. Sleep patterns: does sleeps normally 7 to 8 hours or sometimes 7 hours, but last few days because of cough he could not able to have proper sleep because the cough was making him awake. Relationship status: GD is divorced, live with his girlfriend, does not have any kids with the previous marriage. Occupation: does work as IT consultant. Exercise: does not do any gym workout or anything, but does go walk every day evening with his girlfriend. And it's very independent. Review of system: uh, JD does not have any fever, headache, does complain of little headache, but it's not bothering him. No weight gain or weight loss intensely or within couple of months. On ENT examination, the eye does he does not wear any glasses, no drainage or redness of the eye, and do not have any vision issues. Ear, nose, mouth, and throat: no ear pain, or any hearing loss. Does not have any kind of nasal drainage, but does have little congestion too. Denies any difficulty swallowing, or does not have any issue in the oral cavity. Cardiac wise, no palpitation or no chest pain. Pulmonary: has a productive cough with the yellow color sputum, does have some sometimes hard time to breathe due to cough. Whenever he has a lot of cough, he said that he has a little hard time breathing to catch the breath. uh, Musculoskeletal system, steady gait, no joint or muscles ache at this time. Neurologically does not have any headache or dizziness. Allergies, as I mentioned, no seasonal allergies or environmental allergies. Objectives on arrival, the vitals was a heart rate was 80, blood pressure 110/70, temperature 98, does not have any fever, 96 on 96 saturation on the room air, and does have a pain at the mid sternal area due to cough, and the pain level is 5 out of 10. um, Lab, there is no current lab has order or any radiology study. uh, did the covid home test, which was negative for him. Physical examination on general, he's well dressed, clean appearance, does follow commands, and look straight, and uh, there is no some there is some look tired due to not proper sleep. Eyes, perla, no redness, swelling, wet or any cluster eye near the eyes. Does not wear any prescription glasses. ENT and mouth, no pain or tenderness during the palpitation of the sinus. Um, Sinus, ear or nose, no polyps, no difficulty in swallowing. Mouth is pink, moist, no cut or open wound for in JD's mouth. Cardiac wise, can hear, able to auscultate and able to hear S1 S2 sound clearly, no murmur or any irregular heart rate. Pulmonary, on auscultation, slightly wheezing, heard on inspiration, had some coarse crackles on the both side bilaterally. Lungs expand symmetrically, crackles clear up while coughing. Musculoskeletal system, steady gait, no joint or muscle ache or any weakness at this time. Assessment, after collecting all history, social history and primary history of the patient. The patient assessment came up with the three differential diagnoses. The one is acute bronchitis, ICD code 10 is J20. Second one, allergy rhinitis, and third one is pneumonia. The final diagnosis is acute bronchitis. The condition would be primary diagnosed due to the patient history of cough for a week and symptoms of wet productive yellow sputum. Physical exams of the lungs show slightly wheezing without any fever. Uh, the, uh, the lab's order for to confirm to rule out pneumonia. We did the chest X-ray to rule out the pneumonia and COVID-19 nasal rapid swab test just to double check the patient doesn't have any COVID thing, despite of he had a negative COVID test at home. Treatment, antibiotics are not recommended for the viral bronchitis. Symptomatic treatment can be taken as Tylenol 650 milligram PO every 4 to 6 hours as needed for the pain, and can drink warm drink to prevent any kind of sore throat. Education provided to JD regarding advice to avoid crowded place, get adequate rest, drink a lot of water to stay hydrated, and prevent any dry mouth or dehydration. Avoid passive smoking to prevent any irritation. If he doesn't smoke, but if anybody around him smoking, he need to stay away from that. That has been advised to him. Cover mouth while sneezing or coughing, and maintain good hygiene. Symptoms will be slowly recover within 1 to 3 weeks. It's a self-limiting and does not need follow-up until unless new onset of fever or any difficulty breathing or any blood in the sputum comes. The office number provided, and ask JD to, in case if any kind of symptoms appears that is not usual, can call the office and come to see the follow-up. Does not need follow-up at this time. And anytime JD has any question, JD can call anytime to our office. This is my presentation on the pulmonary soap notes, and the final diagnosis was acute viral bronchitis. Thank you.